Good afternoon, everybody, and thank you for joining us for a mental health Zoom town hall. Today we are joined with panelists Alan Mednick and Susan Rosenstock. I am David Silvers, State Representative for District 87 in Central Palm Beach County. Now, before we go on with the Zoom town hall, if you're new to the mental health town halls, this is, I think, my third or fourth that I've hosted. It's become, mental health has been a priority of mine when I started in the legislature in 2016. And over the years, built up relationships with individuals within the mental health community. And that's where I've met Alan several years ago. And we've built on that relationship. And we want to be able to bring the conversation into the open about talking about mental health and getting help if needed. So thank you very much for joining and all the attendees online. And Alan and Susan, I'd like to give a brief bio for those that may not know you online that are watching in attendance. Alan is a board member for the American Foundation for Suicide Prevention for Southeast Florida, as well as an American Foundation for Suicide Prevention field ambassador. He has spent the past 7 years helping to bring awareness, education, and advocating for suicide prevention and mental health has become a passion for Alan after he lost his daughter Raven and niece Isla to suicide, and his son Michael struggles with anxiety and depression. Along with starting his radio show on iHeartRadio, and now the podcast Real Convo, which is about bringing hope and help to those struggling with mental health issues, Alan is also a volunteer for 211 Palm Beach County and Treasure Coast. And if anybody here is in attendance that saw the 211 mental health town hall, we had one a few weeks ago. As you can see, 211 has quite a reach. Alan is also a certified Safe Talk trainer. Safe Talk is suicide alertness for everyone and is an ASSIST certified through LivingWorks. ASSIST is applied suicide intervention skills. Alan's mission is to be a voice to let everyone know you're not alone and that suicide is preventable. We're also joined by Susan Rosenstock. And is it okay if I call you Sue?
Please, thank you.
Sue is an advocate, accountant, event planner, mother, and the co-founder of the peer-led suicide prevention organization called umattr. umattr's mission is to change the story from bullying, depression, and suicide to a compassionate culture where every person matters. Susan is also the founding member of the campaign to change direction in mental health. Sue has presented a version of this training program to the Parent Teen Summit for Jewish Family Services, the Philadelphia Coaches Conference, and to the Positive Coaching Alliance at the Delaware Corrections Institute, and to various schools on the East Coast. Sue currently represents one of 68 mental health agencies on the Delaware Suicide Prevention Coalition. In 2016, Sue was honored at the National Alliance for Mental Illness Annual Heroes Dinner, where she was the recipient of the Wayne Fenton Memorial Award for Outstanding Service in Mental Health. Thank you very much for joining us today, Alan and Sue. I appreciate it. I'm sure all of the attendees online appreciate it. I think it's, we don't need to beat around the bush. And mental health is a major issue right now, specifically during the time of COVID-19. And any bit helps, and anything that you can help with any of those in attendance online would really be appreciated. So thank you so much. And I'd love to.
We appreciate it. Thank you so much for everything you do.
You're welcome. Alan, is there anything that you would like to, maybe go on, discuss a little bit more about the foundation and what you do?
So basically, again, I'm with the American Foundation for Suicide Prevention. We're an organization that basically started in 1987. It started as a research organization to fight suicide. Since over the years, it grew to about 74 chapters, I believe we have now in all 50 states. And we expanded that to not only research, but we do advocacy, education. We're in with law enforcement, veterans, all different areas to really try to help everybody out there and let everybody know that suicide is preventable. And we want people to know also that you're not alone. So that's basically what we do, and we try to do all these outreach. And again, I appreciate you having us on to help expand this.
Of course, I'm happy to have you. And thank you so much for taking the time. Sue, could you explain a little bit more to our attendees online what you do, a little bit more about umattr, you don't mind.
No, my pleasure. 7 years ago, I lost my 16-year-old son to suicide after a basketball back injury, and 4 months later, we were unfortunately at a funeral. So Evan's death was such a shock to his friends as well as to everybody in the community that kids came together and said, if this could happen to Evan, this could happen to anyone. I'm scared. I don't want to lose another friend. So we came together. I brought these kids together and said, what do you want to do? And they all said they wanted to run a 3-on-3 basketball tournament, raise money for teen suicide prevention, advocacy, research, and prevention. And that's when we found the American Foundation for Suicide Prevention already existed, which at that point we started to support advocacy. I've been on Capitol Hill to lobby as a field advocate and legislating. And so what really we do is we teach kids to be able to speak a language that will help them understand certain terminology that would only apply to their peer group. So from 10 to 34, the way they speak about certain maybe changes in their personality or things that may happen is it's going to be different for every age group, really. And so when you can hear from your peers as a high school student how it looks to you to have a change in personality and a friend hears it, they are now 4 times more likely to increase their help-seeking behavior. So we do as many small group gatherings with, as I said, age 10 to 34, to be able to have everybody listen and participate as to being able to understand what those signs or symptoms would look like in their friends or their peer group.
Okay. All right. Thank you very much for explaining that. I'm sorry. Are you getting any feedback? I'm hearing something in the background. Is that from your end?
I'm sorry. There's a horrible storm here.
Oh. Maybe coming from your side. Alan, are you okay with with?
I am fine.
You're fine? Okay.
I'm fine.
You
I
okay?
don't know where else to go.
Are you all right?
Oh, yeah. We're
Good,
fine.
okay.
It's just raining a lot.
So you mentioned about parents and dealing with, right now we're in a really unique climate when it comes to mental health climate, let alone in general, that we're having some major issues at home with our children, and parents really don't know where to go for help. Is that something that umattr could be of assistance with? Is it American Foundation for Suicide Prevention? Who exactly? Where? What's their outlet for help in that regard?
So yes. So basically, all our organizations are great to go to. There's a lot of great organizations out there. Basically, what we try to do is provide some education and training. The main thing that you have to do is you have to listen, be aware right now. Even in times not like this, there's still times that you have to talk to your kids. You have to understand what's going on, see what's going on around them. I will tell you real quick, one of my stories with my son, who has anxiety and depression. After my daughter passed 7 years ago, he started developing the signs about a year after we went and got him help. In 2017, we had to put him into an inpatient facility. I didn't know what was going on. I went out, I'd done a lot of work with suicide prevention by that point. My wife is a nurse, and we just didn't see the signs what were going on with him. It took 3 of his friends to call us and say, hey, Mr. Mednick, we're really worried about Michael. He's been texting these things going on. So the point of it is it took his friends to call us up and understand what was going on. That's in times of where we're not isolated and we don't have a pandemic going on. So my message there is just, anytime, it doesn't matter whether you're in a pandemic or not, it's good to always pay attention. Now it's even more important to do that. So you always want to look for certain signs. Obviously the kids' school year is ending right now. And basically what you want to do is you want to be able to understand, if they have any kind of personality changes, if they are feeling agitated or withdrawn or poor self-care. So when we go through these, we want to see, are they sleeping late? Are they getting up on time? Are they eating? Are they showering? Are they doing things like that? And if they're not, you want to have a discussion with them and find out what's going on. So these are really important things, especially right now when we're kind of stuck together, and it's a good time to have that conversation, open it up with the kids right now.
Do these signs, the 5 signs, we could put that back up there really quickly, the 5 signs slide. Knowing the 5 signs: personality change, feeling agitated, feeling withdrawn, poor self-care, feeling hopelessness. Is it ever really go in a certain particular order, or is it just, it doesn't really matter the order? It could be out of order. It doesn't really matter.
Well, it was designed originally, just to give you a little bit of a brief history, after the Sandy Hook shootings, the White House convened its first summit on mental health. And out of that group came a committee of people who were charged with coming up with a public health campaign similar to stroke and heart, where we could give 5 signs that somebody, even if they didn't know all 5, could identify somebody as in some sort of trouble. Well, with stroke and heart, those are physical symptoms, and we all now know if somebody's clenching their chest or their arm or talking about their jaw, whatever, that they need help. And so this was designed and launched with American Foundation for Suicide Prevention is one of the founding organizations. umattr is American Psychiatric Psychological. There's Aetna, Booz Allen Hamilton. And so these groups all came together and launched this with the idea that if we can come up with a common language to be able to talk about these signs, that this common language would help us understand, yes, there is a progression to this, okay? Somebody's personality changes. How does that look like, particularly for you, for me, and my son? He started to immediately feel agitated, which this was my happy boy. Withdrawn, he went downstairs and hid, and then he did ultimately feel hopeless. So these did definitely go in a progressive order, or they don't necessarily have to.
Did all 5 of these signs actually happen?
Yes.
Yeah, it was. Okay.
Yes. And in my particular case, and we share our stories because we want people to know that this affects everybody. So it really is not unique to any, it has no discrimination whatsoever. So when I share my story with particularly with Evan, is I had the best opportunity that any parent could hope for, which was after surgery. He didn't feel right. He wasn't taking medication. He just wasn't bouncing back. And he told us he didn't feel right. He was 16 years old. And so we did physical tests. Everything came back negative. And he did have back surgery, I think I mentioned. And then just said, well, if everything comes back normal, I want to go talk to someone because I don't feel right. Best opportunity for a parent. And unfortunately, in our situation, we did go to a psychiatrist, and in our particular situation, Evan was the warning on the commercial for drugs that can cause increased thoughts of suicide in young adults. He was taking a medication called Celexa, which I'm happy to report is no longer prescribed for that age group. And so I feel like between the amazing and incredible work that these kids have done with umattr and spreading that word of how to look for those signs and what those signs look like individually to them, along with being able to identify a medication that shouldn't be prescribed, is really something that was Evan's purpose.
And I'd just like to add on to that too, with the warnings, with the signs. It's not always what you think. It's not just being moodiness. It's not just, sleeping too much. It's just change in personality. So you could have somebody that is withdrawn and not like, doesn't like to be social. And then all of a sudden it's the opposite and very happy-go-lucky and talking to everybody in sight. It's a change in personality, and typically what they say is it's something that lasts for 2 or more weeks. So if it's a change in personality that happens for 2 or more weeks, that's when it's something to really address. Obviously, you never want to take anything for granted. If if you feel what we always like to say is use your gut feeling.
Okay, makes sense. Well, what about communication? What about, you said it yourself, if it lasts 2 or more weeks, and I guess the feeling of being withdrawn, does that mean that that individual is not communicating with their friends or the family? Or sometimes, I think, Alan, I think you mentioned that your son was communicating with his friends, but he was not communicating with you, correct?
Right. Basically, and that's why I always do tell people to make sure that you do keep an open communication with friends, with your child's friends, because so the first time my son's friend called us up, we talked to him and he said, no, everything's fine. But we brought him to the psychiatrist and, they talked to him. A couple days later, same thing happened. Another friend called up. We talked to him. He said everything was fine. Brought him to the psychiatrist again. Took the third time for him to open up. And at that point, it was basically just a breakdown. And he said, I love you guys too much. I didn't want you guys to worry about me. So sometimes it's easier for a child to talk to a friend or somebody else than to their parents. And
So he said, I didn't want you to worry about me. That's why he didn't talk to you?
yes.
Wow.
Very often at that point, when these particularly children or young adults are feeling that way, very often people who have survived an attempt have shared with us that they felt that they feel like a burden on their family, and that their family would be happier or better off without them because they're such a burden. And the reason I want to say, and to Alan's point, is how we know that suicide is preventable is because 90% of people who die by suicide have a diagnosable mental illness, which means if we can diagnose the mental illness, get them the help that they need, we can prevent the suicide. So for us, we try to bring that upstream preventive method to getting help for it, so we know it is preventable.
Yeah, and another stat is about 50% of people that do have a mental health illness go untreated.
Right.
So,
50?
Yeah.
Wow.
That, and very often with children, there is an approximate 10-year time period between their first symptom and the time they actually are able to get the help they need. 10 years.
Yeah, and actually the first signs of depression or mental health illness actually start at the age of 14.
Do you think that there could be certain adverse, are you familiar with ACEs, adverse
Yes.
childhood experiences?
Yes.
I became familiar with them a few years ago with the Center for Child Counseling in West Palm Beach. Sue, are you familiar with that?
I'm not, but remember, I'm a newbie here.
Right. Well, so with the Center for Child Counseling, and Alan, if I'm leaving something out, please add on. They explained to me that adverse childhood experiences are, if a child experiences more than 4 or 5 before the age of 5 years old, the chances of them being clinically depressed and to have thoughts of suicide by the time they're a teenager is like 10x compared to a child that doesn't experience any of those or just one. And they gave me an example of a child experiencing that they were treating that had experienced, I think, 4 or 5, and she was only 3. And so, for example, I think that her parents, she had a brother, her parents were arrested, they both were convicted, they went to jail, she was removed from the family home, she was put in foster care and removed from her brother in foster care. So there's so many different experiences there that would have a negative effect on that child. And to say that that child would grow and become a teenager, a healthy teenager, I'm not saying that can't happen. They weren't saying that can't happen, but the likelihood of that happening without some help for that child was pretty low.
Well, and that's what it's about. It's getting them help and recognizing what's going on at that point.
And that's why they were hoping that she's 3 years old and she was in therapy. So there's different, I get it, and there's different levels of therapy for a 3-year-old compared to an 8-year-old and a 15-year-old and a 20-year-old. But the help, you just adjust that help to that individual, I presume.
Yeah, and the biggest thing out of everything that we're talking about is conversations, and having a conversation, open dialogue, and not being afraid to talk to someone and asking somebody straight out, are you depressed?
Yeah.
Are you suicidal even? You could ask somebody that question. That's an important question to ask. Yeah, Sue, you want to go through the healthy habits?
Sure. So the healthy habits for emotional well-being came about after the campaign to change direction. The committee formed the 5 signs of emotional suffering. So we like to talk about this because now these are, in my particular opinion, more than ever, I'm using these as a tool to help me through our self-isolation time. And so learning to take care of you, whatever that means to you, these are very individualized. Checking in with others when you're ready to, when you can, think about the people that just might need an extra touch. Engaging with your family and friends. I know it's been kind of fun for me. I have 2 Zoom calls every Sunday, one with my camp friends from 40 years ago, and one is a family Zoom call. So that way we've been able to engage with friends and family through our new Zooms and relax and reduce stress, however that works for you. People do yoga, all kinds of things. And then knowing those five signs of emotional suffering. Again, change in personality, agitation, withdrawn, poor self-care, and hopelessness. And we put this together with part of Healthy Habits right now is following the 5 requirements that that we're being asked to do to stay healthy, right? These are healthy habits we should be doing right now during this COVID-19. We want to wash our hands, soften our elbows, cover our face, get space, and maybe stay home for as long as we need to. So we really just kind of want to be able to tie that together to be able to say that we know that it's hard to be home. So here are some ways that maybe can be an opportunity to look at this in a way that can be a healthier opportunity than the stressfulness that it may bring on.
Yeah, and to go with that right now, it's really important to just try to keep yourself normalized right now. So, one of the, again, talking about it is if you can't go to work right now, if you get up early in the morning to go to the gym, gyms are back open now, so you go there. If not, you do something at home, work out. Just try to do something normalized to do, to keep going. You never want to try to get yourself where you're just going to sit on the couch and watch TV all day type. So I believe that's kind of these healthy habits also, which you can still follow on right now. Well, Sue, did you want to take that call, the personality changes with teenagers?
Sure. Very often that's a big question I get a lot from teenage parents. How do we know the difference between a change in personality versus that could be something that's serious versus having a typical teenage behavior disagreements with your parents? And I think one of the most important pieces of that, there's many pieces, a way to break it down. As Alan said, having their friends be somebody that you're in contact with. And if you think that, just say to your kids' friends, have you noticed that? Or your kids' friends' parents, ask them, have you noticed anything different about, this? Because that's how you'll start to understand. And as Alan said, it's a period of time. And then from the point of typical teenage behavior, when you start to see, like I did with Evan, where he walked in the house and, just slammed the front door, walked by with an expletive downstairs, and I had not said one word. And that was so out of character for him that clearly was the agitation that showed me really this is escalating. And so from a typical teenage behavior, you're going to see some sort of escalation. I usually say that. I usually say talk to your friends' parents and then talk to your kids' friends. And Alan, anything else you would add to that? Typical teenage behavior versus are you in trouble?
Well, again, the main thing that you want to do is not to dismiss anything. You want to make sure that if you see any kind of something that's different in any way, that you address it, you bring it up to them. You know, there's always that stigma that everybody has behind mental health. And I just want to say that, first of all, prior to the COVID, you know, probably, what is it, like 1 out of every 5 people in this country are going to have a mental health issue this year. And it's like 1 in every 25, and I'm not going to go into the stats exactly because off the top of my head, I forget right now, but are going to have a mental health illness. So it's not that it's an uncommon. So we should be talking about it like we talk about, you know, heart attacks, like we talk about diabetes, like we talk even about a broken arm. Just because it's above the neck doesn't mean that you can't talk about it the same way you talk about it below the neck. So don't be afraid to go up and actually ask your child or ask your wife or husband or anybody if they're okay. And, you know, it's important to have an open conversation.
And there are ways to have resources to help you through those conversations. For example, Alan is an amazing resource with his show Real Convo, and he is a great resource on how you might want to ask questions in a certain way or how to continue on with that awkward moment after someone says, I'm fine, you know, or don't worry, and they're very closed-end questions.
So what I was getting at from that legislative update from last year was that you had a lot of parents in there that were shaking their heads, like they were nodding their heads in agreement that mental health needs to be part of the open dialogue and needs to be something that's widely addressed and accepted. But when I said to them, a lot of parents out there, you may be in agreement, but there are a lot of parents out there that don't want to hear that, oh, my child doesn't need help. They're okay. They're fine. And they may not believe in getting help. And I think that's where you have certain issues with certain children or with individuals that they think maybe I shouldn't get help because my parents don't accept it.
There is a huge stigma, and it seems to be I've seen with the kids that we work with, I feel that stigma is much more our generation, where these kids who are coming up now, they've all been used to taking some type of a medication or having a friend who was on some type of medication their whole childhood, okay? Whatever medications those were that you needed it for, it was a common thing. It wasn't a big deal. And so they are so much more tolerant of the stigma of mental health. They don't realize or think of it even as a stigma. They're out there with it, being very open about it. And so my hope is that it's really going to kind of have the kids really pushing up and making this happen as well. But on the subject of parents, I may not be a fan. I may not be popular after I say this, but a lot more parents need to allow their children to take care of themselves, to learn how to fail. Okay, I think that all of us want to do better than the previous generation for our children, right? We all do. And I say we repeat our grandparents' mistakes, okay? So it's to me, parents really need to do the simple things like allow your children to do their own laundry at a certain time when they're responsible. They need responsibility. They need to be able to have coping skills if the washing machine doesn't work right. And these are the things they're missing when in the groups that I deal with, the hardest transition that I see is the transition between high school and college. Having these kids who have been very protected, covered by, parents with very well-intended, raising now are totally inequipped to be alone at college.
So a little bit of tough love is what you're saying? There's nothing wrong with that.
I think that you need responsibility. You need to, have them understand, basic things that, my daughter was in a Chinese program and she went to Beijing and worked there. And it was part of another group that she was the only one from the US. Everybody else was from Europe. And she spent her whole time teaching them how to use the washing machine, how to get a haircut, how to, go, because they just didn't have the resource in themselves to do it. So I feel like it's really, we need to let our kids fail. And the Positive Coaching Alliance talks about this as well. We really, for example, 70% of kids who are in organized sports drop out by the time they're 13. It's not fun. And the Positive Coaching Alliance has taken that and really created a research-based program to help with administrators, coaches, parents, and the teenage athletes to help them. And again, those types of programs, talking about filling your emotional tank from an early age, can help that 3, 4, 5-year-old understand a little bit more if it's starting on the field and it's starting in the classroom and it's starting where people at home, and especially now being together, that they're going to start to see the difference in the change that we can make.
It's also a great program for anti-bullying and also for teamwork and joining and bringing life skills together.
The Positive Coaching Alliance is part of an anti-bullying program?
Well, it teaches them to be more of a teammate. So basically, if a kid doesn't, a kid makes a mistake in baseball, he makes an error, or he strikes out, the kids aren't going to get on him. The kids aren't going to be like, oh, you're horrible, you lost the game for us.
Right.
It's more of a team building
and they
type of program.
teach parents how not to coach from the stands. They encourage it's a whole different atmosphere. Phil Jackson, Steve Young, Dusty Baker are all part of the Positive Coaching Alliance. And actually, I'm proud to say that at our 5th umattr 3-on-3, we were able to launch the 18th chapter of the Positive Coaching Alliance in the Mid-Atlantic region. So because of us, and that was really exciting. So we're making waves.
That's fantastic. Are you finding that a lot of the the students that go through the program, do you find them to be just natural leaders in the community moving forward?
Absolutely. Natural leaders, and they're people who I was really surprised at the point that how we were able to give these kids in high school enough empowerment that they took it to college and started clubs and have now asked me to speak at the American Bar Association. They've graduated college, and so they keep asking for this piece to keep coming with them, help everybody understand what it's going to mean to look like in our group if somebody is emotionally suffering. And on the flip side, as Alan said, yes, 1 in 5 will suffer from a mental illness, but we talk about with the healthy habits, how do we know and what do we do with the other 4 that stay healthy? So we want to learn from those. We want to be able to emulate those, learn and be able to really try to bring about the messages of hope, help, and strength that we can, and show how famous people in the world like Demi Lovato and Alan, some of the others, and how we really have no discriminating.
I think you brought it up, how Bruce Springsteen has a song called This Is My Depression, Demi Lovato, Pink, and Brian Wilson from the Beatles had a film made.
Boys. Brian Wilson with the Beach Boys.
I'm sorry?
Brian Wilson with the Beach Boys.
Why did I say not the Beatles, the Beach Boys.
I'm sorry, I had to correct you, Representative Silver. I'm really sorry.
It's okay. I'm sorry.
And obviously,
and the Beach Boys.
Yeah, and obviously you have Lady Gaga, who's a big advocate.
Yes, Lady Gaga. So I mean, either they're do you see them as they have dealt with this personally, and they want to bring it to light, or they want to bring it to light because they know others are going through this as well. And be friends with them.
You know, so again, it's just like what me and Sue are doing. You know, when we go through something like this, when you go and try to help others, it's actually therapy for yourself too. So it's not only helping others, but it's helping yourself too. One of the things I joke about all the time is if I didn't do all the stuff that I do, I'd be spending $100,000 in therapy bills. So I'm sorry for all the psychologists and everybody out there, you know, that want to take my money, but you know, I do this instead. It really is, and I think also with them, they see it that they're role models. So I think they see themselves as role models to try and bring about change. You know, look, I always try to equate what mental health and suicide to AIDS. And when we go back to what the AIDS were in the 80s.
Right. Nobody wants to talk about it in the 80s.
Nobody wants to. So I actually had somebody that I interviewed, a pretty famous celebrity, where he was talking about how his sister developed AIDS and she got it through a transfusion. And she was in the hospital in the 80s, and the hospital wouldn't let them go up the regular way. They had to like sneak up the back stairs to go visit her. And They had to get in a full like spacesuit, basically.
Like a hazmat suit. Probably.
Yeah, hazmat suit to go see her.
Wow.
I mean, and now we understand that, you know, you could go up, people could live a normal life. It's not a big deal, but why did that happen? Magic Johnson.
Well, also, and just to continue with before that is that my hope in the AIDS story, because Alan and I never realized this until one day we were talking, that we both use this as a metaphor or an example, is the fact that you know, we felt people were going to die. You know, in the 80s, you heard someone had AIDS. Unfortunately, they were going to pass away, is what everybody thought. And now, today, AIDS is in the category as a chronic illness.
AIDS, HIV is, which leads to right, which leads to AIDS, but HIV is now considered a chronic illness. So yes. You can live a long, healthy life with if down the cocktail of medication.
Right, and it's in the same category as asthma. So how did that happen? Well, a group like AFSP, because we need the legislation, Magic Johnson, and that's how we were really able to, you know, take something as big of a crisis as the AIDS crisis with the famous people similar to the ones you just listed on a few minutes ago, and elevate it so that we can say it's happening to everybody. Bruce Springsteen is my hero. He has depression. I know this. He's very open about the medication he takes and about how his wife helped him through this. And so if you know people that you follow and you see stories about this, you can see how you can live with a mental illness that is treatable and live a long, healthy, fulfilling life.
Wow, it's a shame what happened back in the 80s. Knowing what we know now, but the hope and prayer is that people aren't treated that way, and there's not a public perception of that. And I guess hopefully these type of events, these town halls, will help with that. Will help with that perception. What was I going to say? Oh, you brought up an item earlier, Sue, about self-care.
Mm-hmm.
And I guess that's leading to the healthy habits of emotional well-being, self-care, check in, engage, relax, know the 5 signs. Obviously getting the slide up showing that the 5 signs is important so that everybody's aware of them. And the healthy habits, if you start to see a teenager that in that, like Alan mentioned, he said it's like really a 2-week period and where there's a change in personality, and you see that maybe they're not take care of themselves or whatever in those 2 weeks, and it continues on. But if they just naturally change and they start exhibiting healthier habits, do you think it's something that maybe basically is this a pattern of behavior of from maybe a teenager going through maybe emotional changes, or could it be an actual mental health issue? Where's the line drawn? Does that make sense?
Right.
Actually, I I could just say something with that. You don't ever want to, like I said before, we don't want to dismiss, or avoid anything, any kind of signs. So right now you want to take everything seriously and have an open conversation. Look, if I'm going to talk to somebody and I'm going to go, my son, hey, Michael, you okay? What's going on? You don't seem yourself. I've seen you, normally you're doing this, but now you're doing this. And he says, everything's okay. If it turns out that everything is okay, what's the worst that happened? We had a conversation.
Right.
And there's a couple things that could happen. Either it could be that nothing's wrong, something is wrong, we got to get him help, or he is worrying about something, because there are kids out there, there are people out there that are watching, and one of the healthy habits, by the way, I want to talk about is watching the news, not watching the news. You got to have enough time to understand that if you're just glued to the TV all day and watching, all these news channels, it's not healthy. So you want to get away from that. But again, if there is something that is bothering him, and it doesn't have to be that he is suicidal, it's just maybe he's depressed. It's something that we could go get him help. So you have 3 different areas that talking to someone doesn't hurt. There's no downside to talking.
No, there isn't. I'm not saying there is. I'm just saying it's always good to talk. It's always good to get your emotions out. It's always good to get feedback and talk to a professional. Alan, do you want to describe how 211? I know I had a town hall, a mental health town hall with Zoom with 211 2 weeks ago. But do you want to maybe? I don't know. Are you familiar with what they provide as well? In case someone who's watching now that wasn't on for that 211 Zoom town hall.
Yeah, so basically, what does 211 not provide? That's the real question. 211 is an incredible service that we are fortunate to have. So basically, you have the National Crisis Hotline, which is the 1-800-273-TALK number. 211 actually handles that number. So anybody that calls 1-800-273-TALK that's in this area gets directed to 211, whether you call 211 or that number. So that's the first thing they do, which is a very important thing. They also have it separated out. They have actually veterans that are there too, to specialize in veterans. You had mentioned that I'm assist certified. They also have people there that are assist, the trained rather, assist trained to help with interventions. If someone just wants to talk, if they're really concerned about what's going on and they have nobody to talk to, they could just call up and say, hey, can I talk to you? I'm not feeling, I'm feeling a little alone. If you're having problems with your electric bill, if you're having problems with your food, you call them. So like I said, there's basically not really anything that they don't do, but they are known as a crisis hotline too.
And I think it's great thank you for explaining that. I think it's also great to just explain and just put it out to the masses. Anytime I have a town hall like this, to mention 211, because it is an amazing resource in our backyard that not a lot of people realize it's there that they can take advantage of. And I do want to mention the crisis text line that Sue brought up earlier. Sue, we talked about it. It's 741-741. Can you explain that crisis text line?
Sure. And just before talking about the text line, well, including the text line and the lifeline, which comes to 211, I want you to know that it's not only there if you're the one in trouble. Of course, that's the first and obvious. But if you're with somebody and you don't know what to do, you can text 741-741. If you don't want to talk on the phone, you text home, the word home, to 741-741. There's a trained counselor that will respond 24/7. And the same with the lifeline is sometimes, I'll tell you myself, I'll share again my own story, is that after Evan passed and I went on antidepressants, I had a change in adjustment and it didn't go well. And my friend was afraid and she didn't know what to do. And she called the lifeline and she found out the 3 questions she should ask me. And she took me to get help because the medication was off. But the point being is, as my friend, she called to say, what do I do? And I think that's an important thing to know, that as a friend or a family member that doesn't know what to do in a situation, you can call that number also.
The 741? I'm
You
sorry.
can text, so you can,
They text.
any of
Okay.
them. The reason I bring up the text crisis line, the crisis text line, is because it is more likely that the demographic 10 to 34 would text maybe and not call. So we have that option if somebody, particularly teenagers, are not comfortable speaking on the phone, and they much prefer to text. So
Are you getting a high propensity of teenagers that text that, or is it mainly older adults?
Teenagers are the
Primarily, you're not getting.
teenagers are the highest user.
Are you, as information about that crisis text line, is that being disseminated around high schools throughout the nation?
Oh, absolutely, absolutely. And various organizations, like when I was up in Delaware as part of the Delaware Suicide Prevention Coalition, we were able to get a grant that allowed Delaware to have a massive campaign on the crisis text line. So I think it's really an amazing thing that should be put up everywhere so that these kids can find another way of getting help that may fit with a better way for them.
Got it. Okay. I had it's interesting being that we're in self-isolation and that in time of COVID, you're kind of, I get it. We're social, but we're not together. And Alan, we talked about this a couple days ago or yesterday, where I guess we're social, but we're not together. But it's not called social distancing. What was the terminology used?
So we're not social distancing. It's physical distancing, but it's not social distancing. So again, yeah, I can't go up to you right now and come up and shake your hand or give you a hug or anything like that. We have to stay 6 feet apart. But we're online right now. We're talking. This is social.
Right.
It doesn't matter where you are. Technology. The thing I bring up, which I think is really funny, is when I was in high school in the 80s. Yeah. If this happened back then, where would we be? There was no computers. There wasn't internet. There wasn't. I don't even think we had cell phones back then. I think it was one line in my house, and I would get yelled at by my parents if I was on it too long because the phone bill would go skyrocketing. We couldn't do this stuff. The kids couldn't be doing school right now to try and keep normalized.
Do you think
I'm sorry, go ahead.
Do you think that people or your students now have access to so many different options compared to what would have been available 30 years ago in the 80s?
There's no doubt. There's no doubt. I mean, my son is upstairs right now on his computer with his friend that's probably 30, 40 miles away with a picture right on his computer with him playing.
So they're social. They're just physically they're distant, but they're still socializing.
Oh, absolutely. And you have to socialize. You have to talk to people. People need to talk to other people. And that's the way we get, there are certain things that we have to do. One of the major things, and again, going back to the healthy habits, is sleep. You have to make sure you get enough sleep, whether it's isolation or not isolation. That's actually probably the biggest point of mental health is sleep. Mm-hmm. And then obviously drinking water, eating, the whole thing. But again, communication with another human being is really important. It doesn't even have to be a human being. Animals are good too. A lot of animals give comfort to people.
Yeah. I saw Sue had her puppy up on the.
I did. When that storm came, he was like right at my feet.
What kind of puppy is that?
He is a Jack Russell Rat Terrier Rescue with a broken leg.
Hey, who rescued who?
Yeah.
There is no doubt about that. No doubt.
I do want to point out to one thing that Alan mentioned, that yes, we're separate, but we're still we're physically we're distant, but we're still socializing. But there are people that are working. So this came up actually at work where a coworker was self-isolating by herself. I think she has a dog, but she just has not seen anybody in quite a while, and she actually lives up in Ohio. So a couple of coworkers put together a little virtual happy hour town, a little happy hour meeting amongst the 4 or 5 of them. And I think it really had a positive impact on her psyche because she started to sound a little better when she's on work calls or in emails when she's emailing back and forth with coworkers. So I think that the socializing via Zoom, it's a great opportunity that you would have never had in the 1980s when you were in high school. Alan, I was in middle school or old school. I don't want to remind you about that. I don't want to remind you at all about that one. But,
We won't talk where I was.
But my wife's on this happy hour app,
yeah.
and she's talking to her sisters or they're having a glass of wine or whatever it is. Her one sister's in New York, her other sister's in Delaware. They're all over the place. And, 5 o'clock at night, they're just call each other and they're socializing. They're like they're at the bar.
It's very interesting. As I mentioned, that I do the 2 calls on Sunday, one with my 40-year camp friends and one with my family. I wouldn't be talking to everybody in my family like that every week. It's just not something that would happen. So this is actually bringing us closer together for the social aspect. But Representative Silvers, you mentioned a story yesterday about school, and one of the things that we talk about is normalizing as much as we can in this environment. So I thought the story you shared.
I'll be happy to go over that. And I can see it in my sister and my nephew, who's 7. Yes, he's 7 years old. I did confirm that. He's 7, not 6. But he's taking it pretty hard. He's not seeing any of his friends. I mean, he loves his parents. He loves he loves being with his sister, his little sister. But it's not like he's with his buddies. So it's really taking a hit on him. And I'll explain to you the difference between what he's going through and my sister's friend who lives in New York. And what her children are doing, and they seem to be getting adjusted quite well. The difference is with my nephew who lives here in Palm Beach County. He goes to school here. For school, he has to sit at a computer, watch a recorded lesson, do his homework. He submits it via email. Doesn't have any interaction with the teacher, no interaction with the students. So he's got very much a feeling of alone, at least not alone because he's with his parents and he's with his sister, but alone with not being around his friends. Meanwhile, my sister's friend who lives in New York was telling me that, or told my sister, who then relayed this item to me, is that their children are around the same age as my nephew, maybe a year or two older. And what's incredible is that the students are required to be at the computer at 9 a.m. They have to have their homework ready to email. It has to be prepared and have been emailed to the teacher as of an hour before class starts. And they cannot leave the computer unless they have to go use the restroom or that 1 hour for lunch or a half an hour, whatever it is for lunch. They can go grab their lunch from the kitchen and they have to bring it back to the computer, and they have to stay at the computer from 9 a.m. to 3 p.m. And it's like a Zoom meeting. So it's them looking at their teacher who's actively practicing their lesson or teaching them their lesson with the other 15 other students in the class. So they can talk to their friends. They can at least see their friends, maybe not talk while the teacher's talking, but they can talk with each other during lunch. And I believe that is the big item, that they can talk with each other. They can share stories with one another, what they're going through, how they're going through it together, but yet they're not together. They're doing this virtually. And I can see how that has really been I think an improvement on what's happening right here, right now, at least down here. And it's something that I would really love to see be addressed at Palm Beach County or at the state level, to have that type of environment where the students can see each other and they can at least talk to one another online in the classroom experience.
Especially with the idea that since we really don't know what going back to school is going to look like and how you're going to fit all those kids with that type of physical distancing, maybe there's some hybrid coming in our future of in-school online opportunities that this is setting up that is going to become again a normalized.
What I saw last night, saw last night on the news that 20%, supposedly 1 in 5, so 20% of teachers are not looking forward to coming back to school. They may not come back. They may go into another field of work because of this COVID-19. Does that mean that maybe they would continue to be teachers, but maybe they'll be online teachers? Maybe there'll be more options to have homeschooling. We're kind of in the unknown, and the school district in the school, and the school board is meeting next week, Wednesday, to go over plans and policies, procedures to try to open schools back up in the fall. But the CDC has put out guidelines at the national level, basically staggering recess for the middle schoolers, staggering times for when students arrive, staggering times when they leave school. I don't. There's going to be some. It's an assumption there's going to be some kind of logistical nightmare when it comes to lunch. I mean, what happens? You have to spread everybody out 6 feet. Do the schools have enough space to space everybody out 6 feet to have lunch? Are they going to let everybody just eat outside? What if it's raining?
Are they going to make it through the lunch line if they have to be 6 feet apart while they?
But here's what humans are amazing. We're amazing. I mean, we learn to change, we learn to adapt, and that's what life is about: learning to change and learn to adapt to it. And we see it throughout everything. We've had 9/11 where we were shut down. We had to adapt to travel and everything back then. We've had, again, the AIDS crisis. We had all these things. And anytime something comes up, we come out better for it. I mean, I don't want to say that. I'm saying that with a grain of salt. Obviously, there's a lot of people that are sick and everything, but still, you look, the computer, the internet, where did we get that from? We got it from basically war. We wouldn't have had this if it wasn't for the military.
Right.
Even phones and everything else that we're doing. So something's going to come out good of this. I mean, it's gotta. I mean, whether it's bringing, jobs back, whether it's, healthcare being better, having telehealth, whether it's schools being able to do online, we're going to adapt. We're going to change, and we're smart. There are smart people that are going to figure something out to learn how we're going to get the kids back to school.
Well, I like your positive outlook. I think Sue shares that. I share that with you. Yes, there are. There is the negative toll, the death toll of what's happened as a result of COVID-19. But hopefully we can look at the silver lining to this and get through and get to the other side of this and hopefully be a stronger and better society as a result of it. And it's not just affecting us as a country or a state, it's affecting everybody worldwide. So maybe it'll bring us together. Hopefully it'll bring us together. So.
And you've seen that with all the Zoom, the people going online and doing all the music. Look at all these schools that are getting the choirs together, and doing these amazing. Could you imagine? They actually sound probably better on Zoom than they do. Well, they probably sound the same as they do on Zoom as they do if you heard them live.
Yeah, I mean that is the case unless like the internet does cut out, like in my instance earlier.
I have been inspired by a lot of creativity, though. I have seen throughout all of this, from young kids stepping up on their 3D printers and making masks early on to, I'm just, again, as Alan said, inspired by the fact that, we can't change what's happened. We can only figure out a way to make it positive and go forward with hope, help, and strength. And really, as Alan and I always believe, there's a lot of different organizations that talk about mental health, mental well-being, and what we try to do together is really bring in all of those. That's why we talk about AFSP, the Campaign to Change Direction, NAMI, Positive Coaching Alliance. These are all these are all ways that we're only going to be able to elevate the subject a little bit more and be able to really have a conversation without stigma.
Hey, that's that. Amen. That's what we're trying to do. Get rid of that stigma, and people get the help they need. I see that it is just past 5 o'clock. We were going to end right at 5, but I do want to mention a couple items. At the very end, we're going to have a 2-on-1 slide. So anybody in attendance online, please stay on. We're going to have an informational slide for 2-on-1. And also, and I don't know if anybody in attendance realizes, we have an option for Q&A. So if you have any questions, please submit them now. We'll try to address them before we go. Alan and Sue, you want to give a little final comments before the end?
I would just like to say for everybody to, again, stigma is the best thing, is the thing that we're trying to defeat here. And the only way we're going to defeat it is by having a real convo and everybody just being able to talk. take this opportunity right now that you have. We go through life every day, and sometimes it passes us by without even blinking, and we don't know what happened that day. Sometimes we don't even know what we had for breakfast. You could take this opportunity, recreate yourself. I had the radio show. I couldn't get in to do the radio show anymore. We created a podcast that now is probably bigger than my radio show. So, you got to do things to try and take advantage of what the time that you have down. And again, just to have a conversation, reach out. Don't be afraid to reach out to anybody if you are struggling. There's nothing to be ashamed of. And, the last point I want to make is people do feel alone, at times. So make sure that sometimes it's better just to listen to somebody, just to let them talk and just to listen and just be there for somebody. And it makes a world of difference.
And
Thank you,
nobody has to have a professional degree to do that, to be a good listener.
No. And I just want to represent ourselves. I just want to say thank you. And you are a champion for, everything you do in mental health. And I really appreciate you taking the time to do this.
Go ahead, Sue. I'm sorry.
Oh, I'm sorry. No, the only thing I would like to say is thank you again, Representative Silver, for asking us to be here today. And I would love to leave people with a thought of gratitude. Okay, gratitude is something that is very powerful, and there is a simple exercise. And now that we're self-isolating or home more, might be easier to do it. But if for 21 days, at the end of each day, we write down 3 things that we are grateful for that happened that day, it is proven that your mind will then be able to shift into being a more grateful person. So I challenge everybody who's listening to have a gratitude 21-day challenge where at the end of every day, that day, think of 3 things you were grateful for and write it down.
That seems great.
And always remember you matter.
Always. Well, it looks like, well, thank you very much, Alan and Sue. I did check, Sue, while you were giving your final comments, there were no questions. So this is a first. I'm sure we'll get questions in the future, but and if you have any questions, you can reach out to my office at 561-357-4824, or you can email us at david.silvers@myfloridahouse.gov. And please stay on. There's going to be a 2-on-1 slide at the end of this with some information on 2-on-1. I just want to say thank you very much to Alan Mednick and Sue Rosenstock.
Thank you.
I appreciate it. And I'm very sorry that I mixed up the Beatles with the Beach Boys. Brian Wilson was never in the Beatles. He was always in the Beach Boys. I think he was a founding member.
Yes.
He's the high voice.
Right. So thank you so much. And I guess it's now to, I appreciate it. Thank you. We'll end the meeting now. We'll put the 2-1 slide up. Thank you.
Thank you.
Thanks. Thank
Bye.
you.